Knee pain is a common complaint in active clients as well as those with injuries and degeneration from aging. Hi, I'm David Marin for Health Matters Seminars. Because the knee is a weight-bearing joint, it is important to have assessment and therapy as soon as possible after injury. Pathologies get worse just living life. Assessing the knee can give us information regarding soft tissues that may be contributing to the problem, and/or possible joint involvement which may require referral to a physician for diagnostic tests. Chondromalacia Patella is a condition that presents with knee pain from a softening of the patellar cartilage located posterior to the patella and articulating with the femur and tibia. Clients complain of knee pain and stiffness and may also report a crackling sound. As massage therapists, we can help to manage the swelling that surrounds the knee from this condition and treat the soft tissues with hydrotherapy, range of motion, massage therapy techniques, remedial exercises, and self-care for pain management. The test for Chondromalacia Patella is the Patella Grind or Clark's test. I place my hand over the kneecap and distract it anteriorly while my client is relaxed. I place it in a distracted position, and then I ask my client to bring that kneecap up by tightening the muscle in his leg. And as he does that, if there is pain and discomfort and cracking noises, that is a positive test. In this case, it's a negative test, but I do want to tell you why I'm looking at his eyes. As I distract this patella in this manner, let it relax, please. Let me distract it. And I turn to ask him, just simply ask him to do that. If in fact my client's face goes into a look of apprehension like, you want me to do that? They know that it's going to hurt because they've had that knee problem before. And apprehension on the part of the client constitutes a positive test. It's best to repeat the test several times, beginning with very light pressure, increasing the pressure each time and comparing the results with those of the unaffected side. The amount of pressure applied must be controlled, as too much can elicit a positive response in normal individuals. This assessment should not be used alone to determine the presence of patellofemoral pain, but rather with anterior cruciate ligament and posterior cruciate ligament assessment. Recall that the cruciate ligaments cross in the knee, that's why they're called cruciate. The anterior this way, the posterior this way. So, to do this test, I usually sit on the foot to isolate it so it doesn't go anywhere. Sit on the edge of the foot just for stability. Place your hands interlaced underneath the knee, behind the calf, and we do the anterior drawer by a pull of about 2 seconds, a pretty good strong pull of about 2 seconds, to see if there is a movement, a translation of the lower leg from the knee, indicating a torn or inflamed anterior cruciate ligament, especially a torn one. And that pull gives an indication, and it will usually result in pain. And a positive test will be pain and translation of the leg forward. The anterior drawer test. Now for the posterior drawer test, testing the posterior cruciate ligament, the position is here on the front of the knee, and then the push is just like that on the lower leg, pushing it toward the table. And if there's a translation of any kind of that lower leg or pain when doing that push, that is a positive posterior drawer test and could indicate involvement of the posterior cruciate ligament. So these two tests are very valuable if we are looking to find out if they have a problem, literally a torn problem, with the anterior or posterior cruciate ligaments. Remember that we do not diagnose. We conduct accurate assessments, treat when appropriate, and report positive tests to physicians and insurance companies. For more free videos and all our course information, go to medicalmassagetherapyclass.com. I'm David Morin.